Have you ever experienced your heart beating fast? Your chest is pounding. Some people describe it as heart palpitations. And there's no reason for it. You are not running, you're not walking, you're not doing anything strenuous. Your heart will just start beating. Sometimes you beat fast, sometimes you pound and things like that. And you may think, oh, something may be wrong with your heart. It may not be. Let me describe this for you before we go back to our cereals. We're going to connect it. Think of your body as a city, and you have these tiny little trucks that drive all over, millions of them. And their job is to carry oxygen to different parts of that city. And without this oxygen, things can go wrong. Those trucks are your red blood cells. They carry oxygen. That's what they deliver in every part of that city, all over your body. So when you don't have enough blood or enough trucks to carry the oxygen, what does your heart do? Your heart is not being able to pump to get oxygen to all the places it needs to get oxygen. So it begins to work harder, thinking that, oh, something is wrong. I need to work harder in order to meet up. And that is how come you may start feeling those palpitations. Now, mind you, that is not the only reason why you may feel palpitations. It could be due to anxiety. It could be due to coffee. Yes, coffee can make some people feel that way. It could be your medication. It could be a thyroid issue, or it could actually be something wrong with your heart. But in some cases, it's none of this. It's related to your blood supply, hemoglobin. And that brings us back to the test result that will help your doctor to identify this. So if this keeps happening, you need to see your doctor. You want them to take iron test, ferritin test, and maybe other iron studies. But this ferritin is very important. If you remember from our previous video, ferritin is iron storage. Iron is what your body uses to make hemoglobin. Hemoglobin is what helps red blood cells, is inside red blood cells, carry oxygen to different parts of your body. And if you don't know anything else, you know that if a part of your body is not getting oxygen, it's going to die. The same way, when you stop breathing oxygen, that person have died. So, if you don't remember anything, remember that. So you want your doctor to look into your iron, hemoglobin, and ferritin. Especially ferritin is low. You want to get that up. And once you get it up, you see those palpitations may stop. If you have looked at every other thing and you don't see anything else wrong, this is worth doing. Because if you identify the cause of a problem, you can easily solve it without taking medications or without waiting till it develops into something worse or something more severe that will require you going to the hospital, going to be admitted, and they will have a whole cascade. Remember, your body whispers before it screams. By the time it starts screaming, things have gone wrong. It's going to cost you more time, more money, and God forbid, may cost you your health. So, thank you all for watching. Now you know the things to look at if you're having palpitations. If you drink a lot of coffee, the first thing to do is slow down and see if it goes away. If it doesn't go away, you keep going. Okay? You see your doctor, and now you know the questions to ask your doctor. You can also be able to interpret your own lab result because you have learned something from this channel. So my job is to help you decode what your lab result is saying because it's trying to tell you something. And most of the time, you are your own health advocate. Don't leave it entirely to somebody else. Because what do that person have to gain or lose? You have everything to gain or to lose. Thank you for watching. Until next time, may God bless you. Bye-bye.